Moving along quickly, because time is not our friend right now, we receive the chairman of this public lecture, His Excellency Alhaji Atiku Abubakar, GCON, former Vice President and Chairman of this public lecture series. Please welcome him as he gives us his address. I'm pretty sure we can do much better.
Thank you very much. Thank you. Thank you. Thank you. The chairman of APC and former Governor John Oyegun of Edo State, the chairman of the Progressive Governors Forum, and our chief host, Owele Rochas Okorocha, our most respected governors present here today. First of all, let me start with an apology for running late. It is not part of the APC culture to run late. I was coming all the way from the extreme northeast. It was more than an hour's flight. And the aircraft had to come all the way from Abuja to pick me, so I do apologize. Secondly, last week, Thursday, I was in Sokoto State to commission a number of projects where I saw true change or true transformation. Not transformation based on the television screens like Hakim had for Imo State. Or not transformation as we see on the television screens by President Jonathan. But real change on the ground. And when I saw it, I said to myself, what is even the business of federal government to do with even roads other than interstate roads? What's the business of federal government with education? Just have a regulatory body. What's the business of federal government with healthcare sector? Just have a regulatory body. What's the business of federal government with agriculture? You don't have land. Devolve all these powers to the states and give them all the resources and let them serve their people. That is just too much. Those of you who are old enough, who lived in the First Republic, Northern Nigeria, Eastern Nigeria, Western Nigeria, did you hear of any federal medical center at that time? Did you hear of any federal secondary school? What kind of federation are we running? Totally wrong structure of federation. Give all these powers to the states, give them all the resources, and make sure that the standards of services they offer are of international standards. And then we will have development. When I came to Imo State last year, it was, even as of last year, it was a totally different Imo State. Today, I was driving from the airport, it was a much totally different Imo State than what I saw last year. This is physical, or what I saw on the ground, not on the television. Your Excellencies, distinguished ladies and gentlemen, I welcome all of you to Owerri, the beautiful capital of Imo State. And in the Igbo heartland. This is the third Progressive Governors Lecture. Those of you who have attended the previous two lectures in this series know them to be serious gatherings featuring erudite presentations and robust debates, and we expect not less today. I am sure today's will be equally enriching, or perhaps much more enriching, in consonance with the tradition of APC, because anything they do today, if they do it tomorrow, you find it is better. If they do it the day after tomorrow, much better, and they keep on improving. The theme of today's lecture is very appropriate and timely indeed. What better time to discuss healthcare in Nigeria than now that the country is struggling to contain the highly virulent Ebola Virus Disease. This disease has been ravaging some of our sister countries in West Africa and has taken some precious Nigerian lives already. I am sure that I speak for all when I say that our hearts go out to those Nigerians who have become victims of this illness just by doing their job of trying to save lives. Can we have a minute's silence for those Nigerians? May their precious souls rest in peace. I particularly commend the Secretariat of the Progressive Governors Forum for the forth-sightedness, timeliness, and relevance of this topic. The arrival of Ebola disease has drawn attention to what we have always known, the urgent need for adequate investments in healthcare infrastructure and service delivery across the country, as well as improved communication on health and other matters. In a way, we are lucky as a country that the Ebola challenge was brought into our country via a progressive state, one that takes governance seriously and has therefore taken quite impressive steps to contain the Ebola scourge. The Federal Ministry of Health and the federal government took a cue from Lagos and have so far exceeded my expectations of them in the management of the Ebola challenge. I commend them as well. But beyond Ebola, we have a central challenge of providing for the good health of our people. The government exists primarily to protect and provide for the welfare of its citizens. Otherwise, it loses its reasons for existence. Incidentally, security and healthcare are two of the areas in which we are currently facing urgent and grave challenges. We are not providing adequate security for our people, and we are failing to provide good healthcare and education for our people as well. And the very high rate of unemployment and poverty only make matters worse. Our doctor-to-patient ratio of 1 to 6,400 is far below the WHO standard of 1 doctor to 600. At 54% access to improved water source and 35% access to adequate sanitation for our people, Nigeria is among the lowest in the world. Figures for infant mortality and maternal mortality of 74 and 630 respectively put us among the worst in the world. Even in Africa, we do not rank well on all these indices, which is a shame to say the least.